In this video, I am going to discuss about hyperkalemia, one of the most famous topic for NCLEX. Once you know this topic, once you know this content, you will be able to crack a lot of answer regarding hyperkalemia. So let's discuss about hyperkalemia. So what is hyperkalemia means? Hyperkalemia means a higher than normal level of potassium in the bloodstream. A higher than normal level of potassium in the bloodstream. If the potassium is high in the bloodstream, it's called hyperkalemia, right? If potassium level is low in the body, it will call hypokalemia, right? So I will go step by step so you will be able to grasp more information. So that's what called hyperkalemia, right? So what is the normal potassium level in the body? So normal potassium level is in between 3.5 to 5.0 millimole per liter, right? Some of the books they have various number like 3.5 to 5.0, but the baseline numbers are 3.5 to 5.0. So that's a normal range, right? So in case if the patient potassium level go 5.6, 5.7 or above 5, let's say, what's doctor gonna prescribe? The doctor is going to prescribe the medication known as Kxalate. Another name of Kxalate is sodium polystyrene sulfonate, right? So during your NCLEX exam, either they're gonna give you this name or mostly they're gonna give you this name, so sodium polystyrene sulfonate, because they're gonna use possible this name. But another name is Kxalate, right? So we're gonna use Kxalate during this video. So during your exam, in case if you get question, what is the primary reason of patient receiving Kxalate? What is the primary reason? So as we know, we want to bring potassium level back to normal, right? But this medication is given to treat what is going to treat? It's going to treat hyperkalemia, right? So this medication is given to treat hyperkalemia. How does that work? This medication binding to potassium in the GI tract, and then it will help excrete. So that's mean the patient will have bowel movement. When patient will have bowel movement, his or her potassium level will also get exit from the body. That's how this medication is going to work. So whenever the nurse is about to give Kxalate, so another NCLEX question. So they might ask you, and the nurse is ready to give Kxalate, what the thing, what thing you have to look first. So what you have to look first, assess for recent bowel movement. That's the first thing you look for when you're about to give Kxalate. Assess for recent bowel movement, because Kxalate work in the colon and by exchanging sodium for potassium. If bowel movement are not coming, it can accumulate and cause necrosis. So assess bowel function first. So this medication function is to like replace sodium for potassium. But if the patient bowel is not moving, that's mean if patient is having not any bowel movement, it may be blocked, then this medication will cause necrosis. So you always have to assess bowel function first, right? Right. That's the next thing. So if a patient tell another NCLEX question, if patient is taking Kxalate, which information require further teaching, right? So the patient is going to say, it's okay to take all my medication at the same time. That answer would be wrong, because the patient should not take Kxalate with other medication. The reason is it will like Kxalate can bind with other medication in the gut and reducing other medication effect. So if you take Kxalate with other oral medication, it will reduce the other medication effect. So that's why whenever patient is taking Kxalate, should be taken 3 hours before or after other medication. So Kxalate should be taken 3 hours apart, before or after. Right, right. which require immediate intervention. So the patient will tell you, I have no bowel movement in 48 hours. As this medication take, whoever is taking this medication, bowel movement must happen. If patient say no bowel movement in 48 hours, that is required immediate attention, because indicate drug retention which leads to intestinal necrosis. As we discussed earlier, it will cause necrosis. So this is a red flag, and you must notify the doctor that patient has no bowel movement from last 48 hours, right? So no bowel movement in 48 hours, that is immediate intervention. If patient is tell you like he is feeling fatigue and muscle cramp while taking Kxalate, that is another immediate required intervention action by the nurse. Because if patient is complain of fatigue and muscle cramp, you must notify the doctor, because this is a sign of hypokalemia. Patient potassium level dropping, which is causing him or her fatigue and muscle cramp, which occur with Kxalate. So this need urgent assessment and labs. So doctor might order few labs, and the labs doctor can add to check potassium is either BMP or CMP, whatever the option you will see, BMP or CMP. BMP means basic metabolic panel, CMP means complete metabolic panel. They both are pretty similar, but they both read sodium and potassium labs. So either BMP or CMP, right? If patient is taking enema, if patient is taking Kxalate at enema, right, tell the patient to retain the enema for 30 to 60 minutes before flushing. So you have to tell the patient that you have to hold enema 30 to 60 minutes before flushing, then flush with the water. So during your exam, you might get question regarding patient is on Kxalate, select all that apply. So the correct answer would be this medication may cause diarrhea, which is normal. Loose bowel movement is expected while taking on Kxalate. Loose bowel movement common. So this is correct answer. Avoid taking medication with other. Yes, the patient understand that. As we discussed, this medication should be taken 3 hours apart. You must have bowel sound before taking this medication. Right. So this is also correct, because we are assessing bowel function as well. So finally, few more things that you need to know. You have to watch. So if they give you which wave is going to monitor, so you're going to watch for elevated tall T waves on the monitor. Elevated tall T waves, that you're going to select this answer, right? If the Kxalate is working properly, what's going to happen? It will help to decrease sodium potassium level. So that's mean the potassium level will come under the range, in between range. And potassium, another thing is if the potassium is low, if potassium is 2.0, then what we're gonna do, we're gonna give potassium 30 MEq IV push. Again, if the potassium is below 3, then the doctor would prescribe potassium 30 MEq IV push. But if the potassium is super high, like 9.0, then prepare for dialysis and place the patient on cardiac monitor. That's what you're gonna do. So if you go to Google and find any question regarding Kxalate, if you have gone over this, you will be able to crack a lot of answer. So go over one more time on this video, you will be able to crack a lot of answer. Again, the potassium is super high, then prepare for dialysis and place the patient on cardiac monitor. Excuse me. So go over one more time, you will be able to crack a lot of answer by this. So it treat hypokalemia, that's the main thing. Assess for bowel movement, that's another main thing. It's okay to take all my so there are a lot of good things that you must understand. Once you know this, you will be able to crack a lot of answer. Good luck.